Every year, millions of people all over the world are being forced into slavery or human trafficking. U.S. officials say that number is pretty staggering in this country, with about 600 to 800,000 people falling victim to this crime. Now, right here on Delmarva, there are thousands of people who are getting trapped in human trafficking as well. Thankfully, there are many dedicated professionals who are working to stop this. Thank you for joining us today here at 47 ABC for this special broadcast on human trafficking. It's an issue that continues to challenge professionals in law enforcement, victims' rights, and healthcare. Today, we will spend time talking to people working to combat this crime. Now, right now, I have two women joining me, Yolanda Schleyback from Zoe Ministries and Nikki Morris from BB Health. Ladies, thanks for participating today.
Thank you.
Thank you.
Thank you.
So we're just going to dive right into the questions. One of the things is I have you both up here together because I know that Delaware has its own unique challenges in combating this crime. Can you tell me a little bit about how that, works with what you're doing?
We are uniquely positioned on the 95 corridor, which makes Delaware a hotbed for trafficking. And because we've only had state legislation since 2014, it's sort of a new conversation in our state. And so my fear when I started this work was that Delaware would become a safe haven on the 95 corridor for predators who were looking to exploit their victims without fear of arrest or prosecution.
Interesting. What about you working in healthcare? Do you see anything unique about working in Delaware in terms of human trafficking?
Delaware, yes, most definitely, especially in our local community for BB Healthcare. We have a lot of people coming through the summer months traveling. We get people vacationing from all over the place. So it's definitely a problem in our area.
Now, one of the things that I just saw this week as we were putting together this special, I saw that the Delaware Department of Human Services put together almost like a list of questions that healthcare professionals can ask people that they suspect of being trapped in human trafficking. Can you tell me a little bit about that and how you might be implementing that at BB Health?
Yes, so we have a questionnaire that we ask all of our victims that we suspect, or if they're self-identified. So there is a whole list that we can go through. If they identify one of the first three as a positive, we can screen them in and we can get our local FBI and law enforcement involved.
As a healthcare professional, can you tell me maybe just a couple things that you might see in a victim that tips you off that they might be having a problem?
Sure. If they have someone that's with them, that's speaking for them, that doesn't allow them the opportunity to answer questions to medical personnel, they're not making eye contact, they're withdrawing, they're afraid to answer our questions for fear of future punishment from their abusers.
Wow. Yolanda, how is what they're doing helping you and what you're doing?
Well, medical and law enforcement are both first responders. So in order to identify perpetrators and victims, those two service areas have to be engaged. And so once we're able to identify predators, that means we're also identifying victims. Then we have to answer the question, what do we do with these survivors once we identify them? What kind of infrastructure do we have in our state? And that's where victim services folks come in.
Interesting. One of the things that stands out to me, and as you try to kind of research this, is because this is a big issue, is I think that one of the things people think about is they always think that sex is involved. And I'm learning from the reading that I've done that that's not necessarily true, right?
Polaris Project has identified 25 different forms of human trafficking domestically here in the United States. I would say, based on the research and the folks that I've talked to in victim services, that sex trafficking is the plurality of the trafficking in the United States, but we absolutely have labor trafficking on Delmarva as well.
Wow, wow. Do you see, I know that sex trafficking is probably one of the things that you see come through, like your ERs, but yeah. Do you see some of the other forms of human trafficking that Yolanda touched on?
We certainly have that in our scope that we could see that. I've personally only seen the sex trafficking here at our hospital, but guaranteed it's more than just that.
So one last question, ladies. I want to ask everyone this, and that is, how can the public help you do your jobs? Is there anything that we can do that we should be looking for to help spot this crime?
First and foremost, we have to be able to identify it. So we have to educate ourselves on what it really looks like. And there are a lot of different documentaries, a lot of different books. There are websites, including mine, that have some of the different red flags and indicators. So in order to spot it and identify it, you have to learn what it really looks like.
Okay.
And get rid of our preconceived notions of what that might be. And then being able to know, well, once I spot it or once I suspect it, what do I do next?
Sounds good. Well, thank you so much for
Thank
that,
you.
Yolanda. We'll be right back with more on this topic.